Okay, and we're live, Chair.
Okay, thank you so much, and welcome everybody to the first meeting of Health Scrutiny Committee for this municipal year. And also particularly like to welcome a special welcome to two new members to committee, Councillor Chilton and Councillor Cordingley. It's lovely to have you with us, and thank you for joining committee. And also like to say a thank you to any members of public who are either watching the broadcast live or maybe watching it on a catch up later on. We're really glad that you've come to watch us. And just before we start proceedings, really wanted to say a special thank you to everybody that's joined us this evening to present information to us and who has prepared reports to us. We appreciate you're all incredibly busy. We really are grateful for the time that you've taken to do that and to come and speak to us today. We're really interested to hear everything that you have to say. Just a little bit of housekeeping before we move into the agenda proper. Fabiola's already mentioned that if you aren't speaking, please could you mute your microphone. It just helps with kind of background noise, etc., etc. So that would be much appreciated. And if you would like to speak or you want to raise a point, whether you're a member of committee or someone presenting, please do put a note in the chat. I'll keep an eye on that and obviously allow you to do that as soon as is practically possible. So if everybody's okay and set to go, then we can start with our agenda. First item on the agenda.
Sorry to interrupt, Chair. Would you like me to keep an eye on the chat and then I can just notify you if
yeah, that'd be fantastic.
I'll do that. Yeah, thank you.
Okay, thank you so much, Councillor Taylor. Okay, so first item of the agenda is just apologies, and we know that Councillor Dr. Carr is unable to attend tonight. She's busy working in hospital. Are there any other apologies, Chair? I'm sorry, any other apologies, Fabiola?
No other apologies received, but Councillor Akinola is trying to join the meeting via phone. So.
Okay. That's fantastic. Well, we hope that she can join us very, very soon. Do any members of committee for item 2 have any declarations of interest, any interest in the agenda items that they'd like to declare? Yes, Councillor Taylor.
Thank you, Chair. Just to, as usual, just to announce that I am an NHS worker. Thank you.
Thank you, Councillor Taylor. Item 3 is...
No, sorry, Councillor Lloyd.
Oh, sorry, hi, Judith.
Yeah, no, I've definitely got a declaration.
Yes.
I'm a trustee of Trafford Domestic Abuse Services, which is obviously an item on the agenda.
Okay, thank you so much for that. And we
will Chair, could I declare that I am also an NHS employee?
Yes.
Denise.
Yes, okay, thank you, Councillor Wells. So thank you, councillors, for those declarations. Sorry, I can't see you all because I don't have gallery view, so perhaps it's best if you need to say anything just to put something in the chat for me, thank you. Okay, so agenda item 3 is questions from the public. I don't think, Fabiola, we've had any.
No questions received, Chair.
Okay, fantastic, thank you. And then moving on to agenda item 4, which is the minutes from our previous meeting, which incredibly was on the 12th of March last year. So almost 10 months really, almost 11 really, since we last met. And obviously it was just before the first national lockdown. And it's obviously been a very difficult and traumatic year. So I hope everyone has kept safe and well throughout. Is everybody happy with the minutes? I believe they're a correct record. Members of the committee, thank you very much. So we can approve those minutes as a correct record. Thank you. Okay, so moving on to agenda item 5, which is the access to primary care services in Trafford during the pandemic. Just before we move to introduce our speakers, I just want to say on behalf of committee, a huge thank you to everybody that's been involved in primary care service provision. And of course, not just in providing services, but also in this massive rollout of the vaccination programme. Hugely grateful to everybody that's been involved. We know and understand how challenging and difficult it is to have been working during these times and maintaining services as well as the vaccination programme. So huge thank you to everybody involved. Committee is obviously really interested to know how you primary care has met those challenges and managed to deliver services to our Trafford residents. So we're really, really pleased to hear from you this evening. So people who officers who've attended to address this item, please could you just introduce yourselves as you speak, because we have a number of people who are speaking possibly to this item. If you could just introduce yourselves so we all know who you are, that'd be much appreciated. Thank you. So who would like to start? Is it Mr. Pritchard? Is it you to make the presentation initially?
It is indeed, Chair.
Oh, thank you. Thank you. Welcome to the meeting, Mr. Chair.
Thank you for inviting us. And I was just looking at the minutes of the last meeting. I remember it feels like an absolute lifetime ago, doesn't it? Thank you for that, and thank you for the kind words about all the work that people have done over the last 10 months. I'm joined here this evening by Dr. Mark Jarvis, who is both the medical director of NHS Trafford and also is a practicing GP in Trafford and has been for many, many years. And I thought it'd be much more helpful if we heard from Mark about his experience as both medical director and a practicing GP than for myself. So I'm going to hand over to Mark, and he will speak from personal experience. And then obviously we'll both be happy to pick up all of your questions afterwards, Chair. Thank you.
Thank you.
Thank you for that introduction. Thank you, Chair. So yeah, I'm Mark Jarvis. I've been a GP at Washway Road in Sale on the main road since 1992. And I've been medical director at the CCG for the last 3 years or so. I've lost my notes because my computer's crashed. So if I ramble a bit, I do apologise. The pandemic has been a massive change for all of us. So if I start at the start, in March, everything changed, and the guidance to GPs suddenly became that we should not see anybody face to face unless it was clinically appropriate. And we had to adopt a method of total triage. And total triage means that any contact from a patient comes to a GP, they get a phone call or a video call or an email, whatever's appropriate, to explore the problem that way first. And quite often, problems are addressed through remote contact, and patients are only seen when it's necessary to do so. And that's a new challenge of risk for us, because as well as working out the risk of the clinical condition that I was going to treat and advise on, I also had to balance that against the risk of bringing a patient into a healthcare facility where there were other people and there was a throughput of poorly people, and therefore I would be putting them at risk of exposure to COVID. So it completely changed the way we work. And certainly in my conversations with patients, a number have felt that I was hiding behind remote consultations and not wanting to see them, when actually, for most of me, it's quite the opposite. I'm trying to protect them from the risk that would be involved in coming into my building, and therefore only seeing them when necessary. So that was national guidance, and all the GPs have adopted that. To make that easier, a lot of us accelerated the programme to work on a digital platform called Ask My GP. So we'd already done some preparatory work, and some of the practices in Trafford were using that. And that's effectively an online contact form. So instead of a patient having to phone reception, they can follow a link on our website, drop in an online contact form, and that goes into the work or the stack of work that I as a GP on the day have to do. Obviously, not everybody has internet access and can use that facility. And we're finding, between the different practices, between 70 and 80% of patients are actually accessing our services through Ask My GP. But for those who can't access it, the telephone lines are a lot less busy. So my receptionists work in exactly the same way they used to. They receive the calls, they take the messages, they then enter the patient's query or problem into Ask My GP on their behalf, so that all the work comes into my responsibility by the same route. So it doesn't differentiate between people. It doesn't create two separate lists that are addressed in a different manner. and I work through that. We don't offer any routine appointments, which is a huge change, but nearly everything gets dealt with on the same day. So all the queries that come in, we try and deal with on the same day. There will have to be a cut-off late in the afternoon where anything that's non-urgent will wait till the following day, because we can't keep working on into the night. We've got to look after our staff. They're putting a lot of time and effort in at the moment. But the system that most of our practices are using is that digital stack of work that we address. We get back to most patients on the day. If they do need a face-to-face appointment, then the doctor makes that themselves. And it is arranged that way. My own building, for example, we're on 2 floors. Only the downstairs is used for clinical contacts now. We have 2 nurses and 3 doctors' rooms that are available for me to book any patients in. But most of the day, I'm sat upstairs in a different office working on a computer with a webcam and a phone and talking to people and addressing people in that way. So we're working in a very different way. It's taken a while for people to get used to that, but actually most of the feedback we're getting is really good because things are addressed on the same day, and hopefully they are addressed sensitively and appropriately, and people are understanding the risk-benefit equation that we're trying to deal with every time we speak to them in working out how to address them appropriately. The Ask My GP system gives us access to far richer data than we previously had. So I know there were some questions asked about, the reluctant patients, those who rarely contact us. Well, we didn't really have a way of measuring that information or comparing anyway, because every practice collected data in a different way. Ask My GP standardizes a lot of that. So instead of just having information at practice level, we are getting data flows across all the practices that are using it. So we'll be able to collect a far richer set of data. We'll have far greater understanding of the services that are offered or the access that is offered across our practices. That's not at a point of being easy to use and view at this point in time, because the data flows and standardizing it is still an issue, and our BI team are working on that to get that, but that will be really useful in the not too distant future. It also offers the opportunity for every patient who makes a contact through Ask My GP to give feedback. So every single patient gets a message and the opportunity to give feedback. And that's been excellent. The majority of it is positive. And even where there are problems, it's constructive. So certainly within my own practice, we've been able to use that to address problems that have occurred and improve the system so that it is better for people. Again, that's only being addressed within each individual practice at the moment. It's not being amalgamated on a broader footprint, although the learning is being discussed among practices. So that's the Ask My GP and what we've done. Patient contact dropped quite significantly at the outset. People thought that they didn't want to bother us and were trying to protect us. So our contact rate for the first couple of months did drop significantly, and life was a little bit quieter than I've been used to for a number of years. But the national media campaigns about not ignoring problems and getting in touch with your doctor, and the local campaigns that we arranged, we share some of the council comms team. That workload has picked up, and actually our contact rate is now, for my practice and similar for most of the practice across the area, about 15% higher than it was pre-pandemic. It's dipped slightly at the moment. There seems to be a little bit of sympathy in terms of trying to support us to do the mass vaccination. But people are getting familiar with the new way of working. and in general do seem to be contacting us when they're needed. And, despite some initial hesitance, so the feedback often says, I wasn't sure I was going to like this system. I didn't see why I couldn't get a face-to-face appointment, but having used the system, they say that was great. It was very responsive, and I got appropriate care. So, it's not what people might expect in the first instance, but actually it has been quite successful from that point of view. So that's the way primary care has been working. The team that I manage at the CCG who monitor all this have been rather busy with a lot of things. So a number of the data opportunities and the opportunities for us to monitor it to a level of detail I'd like we've just not had the time and the people to do it, because we've had to change so many things at such a rate that a very small team of people have been working very hard to do that. I'll move on to the vaccination programme quickly and give you the highlights of that, if that's all right, and then stop for questions. We've been very lucky in Trafford that our GP networks have been were very quick to take up the opportunity to vaccinate patients, and have been very involved and very active in doing that. So we've vaccinated, on the figures I had, last set figures I had earlier this afternoon, we'd vaccinated over 30,000 people. The absolute numbers are in one IT system. They then go into the GP records, where we can see that compared to age, sex, and at-risk groups. And the detailed breakdown we've got is now for about 28,500 people who've been vaccinated. And we are closing in on completing the first four cohorts in the guidance. So the national guidance says first cohort were care home residents and care home staff. Second is the over 80s. Third is 75 to 80s. Fourth is 70 to 75 and the clinically extremely vulnerable. And we're closing in on completing that. The national target for completion of those groups is the 14th of February. And I think in Trafford, we're going to complete that at least a week early. And we're looking at systems to ensure we pick up new residents in care homes, people who move in. We've had the majority of the housebound and vulnerable from that perspective done. So we've been doing really well. There's a lot of tension and there's a lot of people anxious about when they'll get the jab. So there's been a lot of noise and there's been a lot of inquiries for us to deal with. But overall, we're doing really well. And I think I'll stop at that. I think that's enough of a summary, and I'd be quite happy to answer any questions.
Well, thank you so much for that update. It's really interesting, and I think it's probably generated an awful lot of questions. First of all, Councillor Denise Haddad, would you like to pose your question?
Thank you, Dr. Jarvis. It was very interesting, and obviously it's been a very difficult time for all healthcare professionals. And it sounds from what you were saying that you've seen a lot more people, and it's been positive. And I think, am I hearing rightly that the quality of the patient care hasn't diminished as a result of Ask My GP and not being able to come in?
Some of that may come out in the wash in years to come. It's really difficult to analyse some of it, because there may be people who would have presented early with skin cancer as an example, or something like that that may have not presented to us. So there is a risk that there is a group of the population who haven't been in contact who might otherwise have done so. But actually, out of the contacts we've had, we've not had incidents. We've not had quality concerns. There's not been issues raised to us. So everything we're aware of in the way that people have been consulting, the quality has been maintained.
And can I also ask you, you were saying, I mean, I think it sounds as if it was fortunate that in some ways people were starting to use Ask My GP, and you said that it's going to be good in terms of getting data and analysing and looking at services and etc. in the future. I just wondered, at this point, do you know what proportion of patients you saw face-to-face and what proportion you didn't see face-to-face?
So there's quite a variety. It actually varies a lot by clinician to clinician. And some of the older ones like me who know a lot of their patients actually see fewer face-to-face. Because in terms of a risk assessment, when I know people and I know they're comfortable talking to me, I can be more confident in the information they give me. And I am more likely to be able to safely manage them without that face-to-face consultation. Whereas younger doctors and doctors who have worked in the area for a shorter period of time don't. But overall, during the first lockdown, the actual face-to-face rate was 5 to 6% nationally, and very similar in Trafford. And I think it's crept up to something around about 15% now. So the majority of people are being managed with a remote consultation. I mean, that's not just a telephone call. We have video consultations available. I found that amazingly easy to assess children. You know, where when I was acting as the duty doctor and dealing with on the day emergencies at my own practice, you'd get a kid or a parent phone up because their child's got a rash or they were short of breath. I'd have just said, bring them straight down and see them as soon as possible. I now say, can you do a video consultation? Because in a video consultation, I can assess really quite quickly how the breathing of the child is, what the posture is, a whole load of things that, I can do a minute after they've contacted us rather than 5 or 10 minutes later when they come down, to enable me to make a decision. Sometimes I still have to bring the children down to examine them, but we're all learning to use these tools in a different way. And I think the majority of us are doing that in a constructive way to be able to offer a better service. Mm-hmm. So, yeah, there's a lot of the learning is only going to get written up if or when things calm down. Because actually, most people are working their fingers to the bone. So it wouldn't be a reasonable ask on our part to try and do too much of that at this point in time.
Thank you, Dr. Jarvis, and I'm sure when you do get a chance to write it up, it will be very interesting and exciting for us all. Thank you.
Thank you, Dr. Jarvis. That was really, really interesting. Could I just ask, what are the limitations of the online consultation in terms of, obviously you mentioned about a rash, and obviously you can look at things. I mean, how far can you take that before you feel that you do have to bring people in, and is it kind of limited because of that? Thank you.
Yeah, I mean, all technology has its limits, and actually the responsibility of a doctor is to make a safe decision. So I ask some people for pictures of rashes. The pictures are good quality, very clear, and I feel I can safely make a diagnosis and advise and manage things, without seeing people face to face. I get other pictures that I just don't feel safe with, and I invite those people to come in. So safety shouldn't be compromised in any way. We have to make a decision based on the information we get. So, there is an increasing number of people who can be safely managed in their own home. But if it's not safe to do that, we have to take the safe option and see them. And as I said earlier, that's balancing the relative risks that really a healthcare facility probably isn't the safest place to be bringing people into unless they absolutely need to. And you've got to balance those two sets of risks.
Okay, thank you. That's really helpful. So we have a question from Councillor Taylor.
Hello, good evening, Dr. Jarvis. Can I just say before I say anything, a huge thank you to yourself and to all the colleagues at your practice and all the primary care services across Trafford. The work you've done is absolutely immense over this time. You know, we as a committee and us as a community, personally so grateful to you all, and I just would like to have that recorded because it's been astonishing the work that you've done. And I can absolutely, I'm a clinician myself, I can really identify with a lot of what you have said about telehealth and digital health and balancing that risk and benefit. And there's obviously, I think there's been some really good practice that has you know, has been forced upon us that has come out of the pandemic, really. And obviously there's been some very good practice in your own practice at Washway Road Health Centre, Medical Centre. Have there been any areas of the borough, do you think, that have been, I don't want to say less well served, but maybe it's not perhaps worked quite as smoothly, or there have been difficulties, or have there been any key critical incidents that you could sort of share with us at all, or areas of key learning, you know, even at this stage?
We haven't had any critical incidents. So there's been no major, oh, sorry. I appreciate the thank you. I'm not used to it. And actually, bizarrely, if you work in a vaccination centre, you get more thanks than I've ever had in my career before.
It's entirely, absolutely deserved and really appreciated.
And I will share that. It is appreciated. So, yeah, so we've not had any critical incidents. We've had differences in the way people use the technology and differences in the way people adapt to it. So not all practices are Ask My GP. There are some who just create one great appointment book of telephone contacts and they phone everybody back. All the practices have got facilities to do video consultations and accept photos from patients. You know, so one of the outcomes of a telephone call would be, can you send me a picture of that? But, you know, so all practices have got that capacity within their system, but not everybody's using Ask My GP as the vehicle by which they manage that. But, and yet we've worked together a lot more. So, you know, the vaccine delivery sites are by network. So the 5 practices in Sale are all working together to deliver vaccines at the Life Centre, and you know it's a complete mix. We see everybody's patients. We're all working together, and people are generally quite surprised that you know we are doing that. But it also allows us to cross-pollinate the ideas, and there has been a really good atmosphere of sharing the information and sharing the learning and helping each other use the systems appropriately. So, you know, some people have found it more difficult than others to adapt to the requirements, and some people have been quicker than others, but we've not really had any major problems with it.
That's great. Thank you very much. Do you think some of this will be embedded in, I mean, I think we've changed in healthcare forever, haven't we, really? That's my view anyway. Do you think some of this will become permanently embedded in the way that we interact with healthcare, really?
Yeah, I mean, healthcare was bound to go online anyway.
Yeah.
So online contact is convenient for a lot of people. And this has just, you know, this forced our hand and speeded up the process.
Yeah.
But I have a lot of people who, you know, would now prefer to sit at home or work and me to call them back and either do a video or share some photos, either way. And have that call at the convenience of their own home rather than have to come and sit in the waiting room. You know, so I think a lot of people won't want to go back. I don't think we'll keep the face-to-face consultation rate as low as this if we get clear of this virus, but because there are a number of people who are still more comfortable having those conversations face-to-face, and I do think we should accommodate that because, you know, doing a good job is based on good communication, and we should be there facilitating the best form of communication for the patient rather than insisting they fit into our box and way of doing it, because you know you're able to offer the best service if you do that. But yes, it has changed what we're doing. We won't go back to the previous ways of working completely. It will evolve, and hopefully it will bring the best out of what we've been doing.
Absolutely. Thank you so much. Thank you.
Chair, you're on mute.
Yes, I know. Councillor Hartley, you have a couple of questions?
Thank you, Chair. Yeah, and thanks for joining us, Dr. Jarvis. I know how busy you must be, in your normal day job, and then obviously the vaccinations that I know have been going on at the Life Centre. I had a couple of questions. One, I think, is, well, you've sort of, I think, just answered it actually in response to Councillor Taylor's question, really about the future, really, and so I guess my question was going to be, what do you think the future of general practice looks like in Trafford? So you mentioned that we won't go back completely to how we were. I've been lucky enough to not needed to access my GP during the pandemic, but actually, if that's through Ask My GP rather than the usual story of phoning the practice at 8 o'clock in the morning, not being able to get through, and particularly booking routine appointments is very, very difficult. So it sounds a good way of accessing general practice to me, and it would seem a shame to sort of go back to the old system, if you like, which in some ways seems a bit old-fashioned to me and not necessarily that accessible for patients. So I just wondered, beyond what you said to Councillor Taylor, post COVID, what's your best guess as to sort of how general practice would operate?
Well, Ask My GP existed before the pandemic, so we were developing anyway. There are a number of online options. There's some things you can do privately for a one-off fee. So there's multiple ways you can get medical advice these days, and it was going this way. Part of that development is there is a big company who've been taking over large parts of London and offering services. And the reason that people use those other services, I think, is all about access. If the people who know me know that if they contact us, I'll get back to them on the same day or the next working day, then they're not going to go to another service where they're not known to ask for the advice. If they ring up and have to wait 3 weeks for a face-to-face appointment with me, they probably will go and get the advice elsewhere. A consequence of Ask My GP is, everybody is getting a response either the same day or the following day. And that, to me, is a far more accessible service and should lead to a far better quality of service as well, because problems are not escalating in that intervening period. So I do think we'll probably be using Ask My GP as the contact system for patients going forward. So as I say, the change is that hopefully the risks around actually doing the face-to-face consultations will be less, so that I'll be offered a little bit more readily.
Thank you. That's really, really helpful and encouraging as well, I think, to hear. My second question was about the vaccination sort of program in Trafford, and so I mean it's obviously going remarkably well in terms of what you told us, and that's really, really encouraging. I suppose the thing that seems to be causing some consternation, not rightly so in my view, but is sort of inconsistency in how the vaccines are rolled out, and obviously some practices seem to have an oversupply, and they seem to have taken the decision that, okay, well, we've got the vaccine, it goes out of date this evening, so let's phone somebody up and can you come to the surgery in 10 minutes, and it's somebody who's under 50 or under 40. And I don't think there's anything wrong with that. Other practices, I think, have taken the view and they throw away the excess, and they end up getting rid of it. And I think there's also been some inconsistencies in how many doses one can get out of a vial, 5 or 6, and all this sort of business. And my own view is, you're doing remarkably well, and I don't really care, if somebody jumps the queue, to be honest. But I just wondered if there's any, is there any guidance sort of within NHS Trafford, or is there any national guidance, or is there any coming down the line which might help with that, do you think?
So yeah, I mean, we're all working to national guidance, but this is a scheme that was rolled out so quickly it wasn't complete at the outset. So, for example, most of our practices started vaccinating last year. So they did their first cohorts last year, and the guidance changed. I think Martin said it was 5 o'clock on Wednesday, the 30th of December for the following week. So we had a sudden change to the recommendations, which caused problems with everybody being told they needed an appointment for their second vaccine after 3 weeks. So suddenly, oh no, you won't be able to get your second vaccine after 3 weeks. That's going to be 12 weeks. And that was part of the national guidance. The CCG is in a supporting role. This is a national programme, national contract for the GPs. And we've been doing our hardest to support everybody to do it effectively and in the best interests of the whole of the population. NHS England, who've been allocating the vaccine, have not got the level of knowledge and understanding of the practices and the numbers that the CCG have, and therefore have not allocated the vaccines as equitably as they might have done. Now, we've updated with the information and we're trying to share it so that the allocations are more appropriate. I don't think anybody's been throwing vaccine away in Trafford at all. I'm not aware of any being wasted. One of my pharmacists dropped a vial, which has got 6 doses in, which was effectively ruined. And she is so embarrassed to have wasted that much because it's just not happening. So we are, I think we're maintaining a good level of usage. And I think all our GPs are doing the best for the population they look after with the supplies they get. It is unfortunate that neighbours in one street who are registered with a different practice have had different access. I've not had any definite evidence that people outside the recommended groups have been vaccinated. I think it's just been at different speeds due to that availability and the allocation of the vaccine. That's what I believe. And we are improving the situation to try and ensure the most equitable delivery across the whole of Trafford that we can.
Thank you, Dr. Jarvis. That's really useful and really encouraging again. So thanks for your time. Appreciate it.
Excuse me, I'm just going to move a little to plug my phone in before I run out of battery.
While you're doing that, Dr. Jarvis, I'll just ask Councillor Cording if he could be ready with his question.
Oh, I'll go for it. I'll manage one way or another.
Oh.
Yeah, quick one first. I just had a quick look at Delamere Centre. They seem to be using a system called eConsult. Is that equivalent to Ask My GP? Is that their version?
Yeah, eConsult is one of the different options to Ask My GP. So I talked about Ask My GP because the majority of practices are on that, and that's the one that my own practice uses, so I'm most familiar with it. But
that's fine.
It's not exclusive. My own practice uses eConsult. I think it's relatively clunky compared to Ask My GP. But yes, they're
parallel.
It is another option.
Yeah. The second one is an anecdotal question, and it might be completely wrong on this. In June, what we saw was massive queues at pharmacies right round the block in some places, and I'm not seeing that now. So is that because eConsult is becoming better, or
it was part of the adapting to a new way of working. So when I do a remote consultation, I'm sat at a computer with patient's clinical record in front of me. When I prescribe now, I don't print a prescription off and hand it over to the patient. I actually send it electronically to the patient's chosen pharmacy. The pharmacies were used to about 25–30% of their work coming on paper, and the other 70%, most of it was routine and repeated, coming through electronically. So the increase in volume of electronic prescriptions meant they weren't processing things as quickly as patients would have hoped. But they've adapted their working model to match, the processes we now have. So I think the queues were about that difficulty in adapting to the new way of working rather than anything else.
Right. No, that's interesting, because it is more efficient, and I think people. I just wanted to make sure people weren't going to people who would have gone to a pharmacy for that first minor consultation, the minor rash, if you like, were not getting missed off completely.
So yeah, the pharmacies being retail have been more open, but they social distancing means that they have limited number of people in the shop at any point in time.
Yeah.
So they've been trying to provide all the same services, but it is going to be slower and more difficult with all the rules that we've got to adhere to these days. But I don't think the clinical support and advice was actually the limiting factor there. There's been no evidence that more people have been needing to consult through a pharmacist. It's more the process of the prescriptions that took time to adapt to.
Yeah. And another one on the sort of accessibility of e-consulting has that addressed any of the sort of gender differences? I mean, I might be wrong, but I always thought men were more reluctant to go to a GP.
Men still are more reluctant. This very simplified psychology, blokes are Superman and nothing's going to go wrong with them until it does. And then when it does, that coping strategy is removed and they're more likely to consult appropriately. But we go through life saying it won't happen to me. And that's on first defense.
I wonder if the psychology is such that if you're talking to a computer, you don't feel they're wasted. I always feel that I've wasted the GP's time. It's my big barrier. And so if I'm talking to a computer, maybe that addresses that. I haven't needed to, but I don't.
Yeah, I'm not aware, because online consulting has been available in a number of forms for a while. I'm not aware of evidence to suggest that has made any difference. But I can't tell you I've specifically gone looking for that data either. It's more of a coping strategy, I think, the way men tend to behave.
Right. And the last one was you might not be able to answer this, but there was an evening news story about an Altrincham vaccine that went to an under 40s. Are we able to address that and say it was definitely only a couple of people? Because it seems
we've in general we've addressed one of the Altrincham networks was getting a disproportionate number of vaccines for their at-risk groups. We can't address individual cases because it would breach confidentiality, and we don't have that kind of information. And as I say, because of that, while there has been a lot of suggestions of vaccines not really being completely appropriate, those people might have underlying health conditions. They might be health or care workers. There are so many possibilities. And so all I can say is that I haven't had any clear evidence that anybody has been vaccinated inappropriately.
Yeah.
But I don't have easy access to all the information to check on every single one of them that they are appropriate. So, I have to trust my GPs are doing the right thing for the populations they serve with the vaccines that are made available to them.
That's fine. It wasn't a question of doubting that. It was really a question of whether there was more information we could just to put a line through it rather than leave it.
Yeah, it is complicated for those reasons. As I say, the clinically extremely vulnerable, so the people with other health conditions are entitled to the vaccination under the guidance, and healthcare workers, and care home workers. And so a lot of the council social care staff are accessing vaccines through Manchester Foundation Trust, either had it or soon to have the vaccine. So there's a lot of people whose jobs actually mean they need to be protected. And that makes it very difficult to judge any individual case.
That's fine. No, thanks ever so much. That's really helpful.
Thank you for that. Councillor Acton, you had a question?
Yes, thank you, Chair. Can I thank you, add my thanks, Mark, particularly for coming along tonight, but for all the work that you and all NHS staff do. It's been absolutely amazing. A lot of my questions have sort of been answered, particularly about the future and how you're going to adapt once we come out of this pandemic. And I think you've answered that. You know, a lot of things you've done differently and they've worked. I suppose the one question that I'd like to know, because no systems are absolutely perfect, and I think we all recognise that. For those people that fall through the net, you know, who have found it very difficult in these difficult times, how have you gone about trying to capture those? It's difficult because you might not even know that they've fallen through a net, and so it might be an impossible question to answer. But obviously, those people will be key people that you'd want to see, but you've not been able to.
Yeah, we're into the Donald Rumsfeld unknown unknowns with that question, aren't we? There are risks in any system. You're absolutely right about that, and no system is perfect, and we don't pretend it is, you know, and it's all going to have to evolve and improve. The obvious gap is you can't walk into the surgery to make a contact. You know, the doors are shut to people who haven't got an appointment, so the first contact does have to be online or by phone. We help that because you can have proxy contacts, so people can contact us on behalf of the patients, and the systems are well established to ensure that the safety of the information in doing that. But that would be the obvious gap at the moment, is that inability to just walk in up to reception and ask to see a doctor and get managed appropriately. Yeah, it's something that, you know, you've kind of answered your own question. It's impossible for me to identify, and the only thing we can do is make the access systems as easy as possible for all groups. And we, you know, the whole system is set up to do that as well as it can at the moment. Like I say, that it runs in parallel with the receptionists still answering the phone lines and putting people into the same stack of work so that everybody's dealt with equitably. And you know, we've got to continue to improve that. And as we come out of the pandemic, other options become available to us. So I think it's one that, you know, we can't say we've got it sorted. We've got to acknowledge that everything can improve, and we've got to look at where, you know, when we have the time, we've got to look at whether there are gaps and groups that are not really accessing the services like we would hope they should. So yes, I think that will be a piece of work when we've got the time to do it.
Do you actually proactively contact people, you know, who you've not seen or heard of, or and you think they may be vulnerable? Yeah, known patients. So again, everybody we know to be vulnerable. So everybody with long-term conditions, you know, everybody on medication, basically people who are known to us. We have systems to ensure that they are monitored and followed up, and that they receive the continuing care they require. The
risk, therefore, would be the people who are not known to us, who don't have a diagnosis or don't have any medication, who we wouldn't have identified for any reason as being at risk.
Thank you.
Thank you, Councillor Acton. Are there any other members of committee who would like to ask a question? Unfortunately, we are coming close to the point where we need to let you go and have your dinner probably. Any questions from members of committee just before we finish our questioning? Any quick questions? Not that any really can be quick, really, to be honest, but anything else? I can't see the entire gallery, so if you just I'll give you a minute to just put something in the chat. Could I just ask one really quick question just before we end? Having worked in the NHS quite a while ago now, there was always issues with IT. Computer systems used to be dreadful and fail. Have you had any IT software issues at all? Is it fit for purpose?
The most difficult question last. The rapid expansion of Ask My GP meant it struggled. There were a number of days early on in the pandemic where it crashed completely and practices had to go to plan B. Fortunately, we've got well-organised practices who always did have a plan B and worked on the telephone list. So yes, the change has put a strain on the system. And as I'm sure a lot of you have found, the internet connections when there's two people trying to work remotely from home, because I can now practice as a GP from home at times and see people at a different time in the day. So, lots of people have found that their home internet connection struggles under the strain of everything we're trying to do. So there's been a number of practical issues. But at the moment, and I hate tempting fate, at the moment things seem to be running okay. We seem to have got over those problems, and the IT kit has been adapted to cope with the current way of working.
Okay, that's very reassuring, it really is. Okay, so it's coming up to 7:30. On behalf of all the committee, we'd like to thank you again you personally for coming this evening, obviously Mr. Pritchard as well for coming along, and thank you so much for all the work you do, to all your GPs, the entire primary care service provision. We are so grateful to for everything you do, and if you could just go back and say that we are so grateful and we appreciate everything you're doing in every field. Thank you so much. Thank you.
Thank you very much. I will share that.
Thank you. Oh, thank you so much. Thank you. Good evening. Have a nice night. Okay.
Thank you.
So, thank you. Okay, so moving on to our next area for discussion. It's agenda item number 6, and I'll just give the title to it. It's domestic abuse in Trafford during the COVID-19 pandemic. And I'm sure committee will be aware, all members of the committee are aware that the minute that lockdown was announced in March of last year, there was obviously a dreadful increase in risk to people of domestic abuse. Obviously, not be able to leave your home must be one of the hardest things that someone can face if they're, a victim of domestic abuse. Because obviously, we need to be able to get out to report these things. So we are really pleased and grateful to officers who are attending this evening to let us know how that situation has impacted on residents in Trafford, what capacity has been like to support residents who face the need to escape domestic abuse, and how they've been able to rise to the challenges and any issues going forward. So I really would welcome, I think, is it going to be Joanne Bryan who's going to speak to us on this issue to start off with?
Well, it's Helen Grant and
Helen.
Brian.
Hi.
I'm Helen Grant. I work in community safety as the strategic manager for crime and antisocial behaviour, and Joe works in public health as our programme manager, so we obviously work quite closely on this. And we're also joined by Sam Fisher, the CEO of Trafford Domestic Abuse Service.
Sorry, thank you so much for joining us. I wasn't aware that you were back in with us because we heard that you weren't able to attend. So thank you so much for finding the time to join us. We are really grateful for everything that's been done for our residents in terms of domestic abuse, and obviously really interested to hear what you have to say this evening. Thank you.
Just to note, we were hoping to be joined by a police colleague, but there's been an incident in the north of the borough that people may be aware of from the news today, and he is overseeing that. So any questions in relation to the police or the police data, I'm happy to take away and come back with a response at a later date. So just wanted to flag that, and it's not for the want of being here, but just an unexpected incident. Yeah, just as Dr. Jarvis opened with saying, March last year seems like a really long time ago now, and it was so extreme in terms of the lockdown and what we were used to before. And I think, for us, because we're in Britain, we'd obviously seen the virus kind of sweeping across mainland Europe, but with that, what we also saw was a rise in domestic abuse cases in Europe. So we kind of knew what was coming in terms of the risk. And I think anybody who works with victims of domestic abuse, or anyone who's experienced it or knows anyone who has, is kind of, was terrified, I suppose, at the time, because as you say, if you're in lockdown with an abuser in your home, isn't a safe place to be. And it wasn't just about that, there was people who couldn't go to work, they weren't having contact with professionals in the same way, children not going to school. So that was obviously a concern for us, not just in my team, but across the council and in our partner agencies as well. And so we set up a regular COVID-19 domestic abuse group. So we do have our normal governance structures, but we wanted to set up an operational group that met fortnightly at least, so we could kind of address those issues as they came up. And we were all very much kind of learning together and trialing things to see what worked well. So, we had colleagues from health, from public health, from housing, education, adult social care, children's, the police. So lots and lots of people came together. One of the key things that we looked at was around kind of capacity of services. Obviously, we were kind of dealing with things in a very different way. One of the first kind of things that came to mind was things like accommodation. You would have people who may have been planning to move, or people who were in refuge who may have been ready to move out, but housing associations and private landlords kind of suspended letting new properties at that time. So it was causing a bit of a backlog. And the other kind of issue was around how we reach people. So that kind of normal contact that people were having, as Dr. Jarvis turned on there, even face-to-face appointments with your GP, health visitors, school professionals weren't having the same kind of face-to-face contacts that they had been previously. And we needed to come up with different and more imaginative ways to reach out to people. Communications was a key one. I think there was a lot of learning at the beginning, because we went into lockdown. People absolutely thought they couldn't leave their homes for any reason. Even if they were at risk of kind of violence or abuse from their partners, people thought that they had to stay put. And there was lots of different things around communication that we had to kind of get right, both at a local level and at a national level as well. And then we wanted to kind of work together to come up with different initiatives to try and tackle some of the issues that we were seeing. I have done a report, and it's quite lengthy, so I'm not going to go through that line by line. People can kind of read that at their leisure as and when they want to, but I'll just kind of pick out maybe some of the kind of key points of things that we did. So one of the first things was around kind of contact with people. We were concerned about children that we knew were living in households where there was domestic abuse. Children's services and education worked hard to try and get vulnerable children in those situations into places in school. But there was also initiatives with people like Greater Manchester Police, and you may have seen this on social media and Twitter, who used their police mascot to go out. So they didn't just kind of like go to kind of vulnerable households, they spread it more widely. So they were doing like kids who had birthdays and stuff, but they were also using that as a way of checking up on the welfare of children in households where we knew domestic abuse was a factor. Working with probation as well. So where we were aware of perpetrators with a history of domestic abuse, checking up on them and current partners and ex-partners, just to make sure that people were safe in that kind of way. And then Trafford Domestic Abuse Service obviously did a lot of work, so they were updating people's safety plans and moving to a different kind of model in terms of how they operated, and more kind of online and telephone calls at the start of the pandemic. Capacity was a kind of key issue. So as I touched on before, accommodation, we were worried that people wouldn't be able to find a safe place if they needed to. And you know, what we were learning from what had happened in Europe is some of the incidents were becoming more severe in nature, and there's some statistics around that in the report. Trafford Domestic Abuse Service opened a second refuge while we were in lockdown in the south of the borough, which was absolutely fantastic. And across Greater Manchester, additional accommodation was made available. So that was really, really good. And then, you know, those meetings that we were having with partners and cross-departmental, one of the things we looked at was data every time we met to make sure that demand wasn't kind of outstripping capacity to meet that demand. I know for things like Strive, who deal with our cases where there might be a report of a domestic abuse incident, but it hasn't been crimed, so they will pick those up. They trained over 100 volunteers to kind of man telephone lines and provide support and do online support as well. So it was just kind of increasing that capacity to be able to pick up some of those things. And then there was so much around communication. So one, just about letting people know that they could get help if they needed to, because I think people thought everything had just locked down and there were no services available. But you know, that wasn't the case. I think people had stopped ringing the police very kind of early on, and we wanted to get that message out there that, you know, the police and everyone was still open for that support, maybe just kind of delivering it in a slightly different way. But you know, as we've talked about, kind of people with health problems, we didn't want to deter people from contacting us if they needed to. So you'll be aware there was kind of national campaigns around that, and there was also the Greater Manchester campaign, and we did a lot locally as well. So we made good use of social media. We worked very closely with Trafford, their communications guy, and they actually have a volunteer who does that specifically for Trafford, and he did loads around that. So there was things like, you may be aware, you can press 55 if you're calling for help, so if you can't speak. So it was getting all those kind of messages out at the time, but we were mindful that not everyone's got access to social media, or that if you are living with an abuser, your phone may be checked. So we did other things as well. So we had little plastic cards printed. So you'll be aware that there was kind of the help hubs that opened up across Trafford. And so we did little plastic cards with all that information about generic COVID-19 support. And then on the other side of it, we did lots of domestic abuse specific information, so that somebody could just put it in their wallet if they picked it up at the supermarket or wherever. And if they were questioned by an abuser, you know, it just looks like generic information, and that might be the reason they picked it up. And we replicated that with things like posters and leaflets. One of the benefits, I suppose, of lockdown in that time was that supermarkets were asking people to shop alone. So that was one opportunity for us where we thought, actually, we can do something around this, whether that's kind of making ourselves known to people who might be suffering domestic abuse, but, you know, their wider family members as well. So we used TDAS's pull-up banner, and we got lots of kind of materials and just made sure that people were kind of aware. We also had a private space. So one of the supermarket chains was really keen to be on board with this and gave us use of their cafe because it had closed down. So we had a stand in the main area. We put signs up downstairs where people were queuing, and then we had a private area with perspex screens if anybody needed help, and we had warranted police officers available just in case anybody kind of said, you know, the abuser's in the car and I need help or anything like that. And then we replicated that in the south of the borough as well. That was a bit of a learning curve for us. It was very domestic abuse focused initially, and we thought that might have been putting people off at the beginning. So we tried to kind of make it community safety and domestic abuse, just to make sure that people could get that information. And we certainly saw an increase in website traffic to both our domestic abuse pages, and I know TDA said they saw an increase in website traffic as well, and an increase in calls, not necessarily just from people who were in that situation, but friends and family members as well who were asking for advice. We also put those cards, so we did lots of community engagement activities just around COVID-19 with public health, but we also used that as an opportunity to put those domestic abuse cards in there as well. So we had some giveaway packs with free hand sanitizer, a face mask, and then there would be an information card in there. The other thing that we were mindful of was police officers potentially coming down with COVID and having to self-isolate, and teams moving about, and the fact that we might have response officers in Trafford who weren't familiar with, you know, what the referral mechanisms were, what support there was. So we set up some information cards for police officers who may not be familiar with Trafford, with details of out of hours emergency accommodation, TDAS's helpline, and all those kind of things. We were also extremely mindful of the fact that when people need to leave their home at short notice, they may not necessarily have all of the things that they need. So we put a bit of a call out to the community to help us create some grab bags of essentials, and was absolutely blown away by the response to that. And, you know, absolutely got to kind of excellent thanks to Councillor Harding here as well, because she went above and beyond, and we got tons and tons of stuff. In fact, somebody said, because we put it all in my office while we were sorting it out, and somebody said it looked like a very badly organised spa shop. And then we put all of those things into bags. So we created, you know, bags for if there was a male victim, bags for families, bags for babies, and women that contained all sorts of things from notepads and pens to toiletries to nappies, you name it, kind of went in there. And we had so many of those, we were able to kind of distribute those across the borough, so they were available for officers to just grab and go. And we also gave some of those things to the refuge as well. When people went in and they had need of anything, they could kind of give us a ring. We also got a supply of mobile phones from GMCA. So if victims didn't have a mobile phone, or it had been taken off them, or it was being monitored, we had a spare kind of phone that we could give to people. What we also saw throughout the lockdown, which I think has kind of been reflected in other countries, is that the seriousness of some of the cases that were being referred were really quite nasty. And you may be aware there's a multi-agency risk assessment conference that brings together all kind of partner agencies to put a safety plan in place to address the risk of some of those people who were, you know, very, very high risk. We reviewed our MARAC and moved from a fortnightly model to a weekly model to increase capacity to hear those cases. And we also increased the number of chairs for the MARAC. So we have put a number of people from different agencies through that training. So we have got a good supply of chairs and deputy chairs, and we now have this weekly MARAC. And one of the other things that I am very, very happy about is we have managed to recruit and appoint a domestic abuse coordinator for Trafford. So we were one of the few local authorities who didn't have somebody specific to. It's so wide ranging, and it cross cuts so many different services, and there are so many things going on, you know, and I'm just kind of skimming some of the things that happened during COVID, but you know, it is huge. So we've got somebody in post now who joined us in October. So he is doing a whole load of work. He's now chairing the fortnightly COVID meeting. So it's absolutely brilliant to have them with us. One of the other things you may have seen was nationally, the rail companies offered free rail travel for people fleeing domestic abuse. We spoke to Transport for Greater Manchester, who agreed to kind of replicate that on the kind of Metrolink network as well. So they were really, really helpful. One of the other things we did as well, we do have a staff policy for members of staff who may be experiencing domestic abuse. And we were very conscious and mindful at the beginning, you know, not just around kind of residents that we work with, but our own staff members who we were, you know, predominantly asking to work from home. We may be asking them to work in homes where they don't feel safe either. So we did a lot of communications around that in terms of the support available and encouraging people to, you know, talk to us or their managers if that was an issue for them. And then also through safeguarding rolled out some training to the hubs, because they were obviously kind of having contact with people more regularly out in communities. So they were really, really good and helpful with that. And then just in terms of kind of next steps, perhaps more widely, you'll be aware that there's the domestic abuse bill, which will become law next financial year. So there's a lot of work ongoing with that. Our last domestic abuse strategy was devised in 2018, so it's due for review this year anyway. So Reece is going to be kind of leading a piece of work around reviewing the strategy. We'll be required to do a strategic needs assessment. So that's another piece of work that will be going on this year. And we have had some funding to support some of those kind of preparations. And we are just waiting to find out from central government what our funding allocation will be so that we can kind of more properly plan our services going forward. So that's kind of a whistle-stop tour of us in COVID-19 and some of the work that we've been doing around domestic abuse, but happy to take any questions.
Well, thank you very much, Helen, for that really kind of very detailed review of your very, very detailed report. So I think we've all had an awful lot of information and the amazing range of initiatives, some of which I had heard of, some of which I kind of Googled to find out a bit more information because they were so, you know, they seemed so innovative and creative. I mean, some of the things that you have done within Trafford is brilliant. I just wondered, would Joe, did you want to add anything to what Helen has said before we take questions?
No, just to say that there really has been quite an increase in complexity of cases that I think we've seen across the board, and that certainly there's a lot more victims coming forward with substance misuse problems, mental health issues, and combinations of those. So I think, and also I think that I don't think the increase in demand came through quite how we thought it would. I think we were all gearing up as lockdown happened for a huge influx in people needing support, and really people couldn't access that support due to their situations. And it was really only as the first lockdown eased that we started to see those referrals coming through for support. And then only really at the very latter end of the year we started to see a rise in the more high risk cases. So it didn't all happen as we thought it would, but because we had that multi-agency meeting and because we were so aware of it, it meant that we were almost ready and prepped for dealing with any issues around capacity and making sure that we could respond to those.
Thank you, Joe. That's really, really helpful to learn about that. Could I just ask, do we have the Chief Exec of TDSA with us? Oh, we do have. Hi, Sam.
Okay.
Hi. Thank you so much for joining us this evening. And obviously, it's really wonderful that you can come and give some information to us. I mean, how has it been for the service? Do you feel that you've had the capacity to meet the extra need?
Yes and no. I think, can you hear me okay? Yeah. No. It's more like, I think, like both Helen and Joe have explained, like we was kind of really conscious and seeing about the increase in demand that we was expecting. So we was kind of prepared a lot earlier than what we thought, because it came a bit later than what we expected. But it's more on what Joe was saying about the complexities of cases. So it's been that what would usually take X amount of time to support somebody or deal with an issue was taking a lot longer, because there were just so many multiple needs that people were coming through with like substance misuse, you know, a lot of mental health support needs. And so I think that's been kind of the biggest challenge, is how complex the cases are and the more time. We've been really fortunate that we've grant funded throughout it all, and you know, we've secured like an extra just short of 120,000 from April to help with increased demand, to help open the new refuge. So things like that have helped. So, but yeah, it is still difficult. It is still kind of a stretch, but it is both demand and kind of the complexities that are the reasons for that.
Thank you, Sam. That's really helpful, really interesting. Could I just ask a quick question before I move to committee members? Obviously, the perpetrator programme is something that's obviously almost preventative, isn't it? Obviously, trying to stop this happening again. And I was quite concerned to read in the report that we received that you've not yet managed to secure funding for that. Is that still the case? And does it follow that that becomes that perpetrator programs are actually issued via the court, so it would be imperative to have funding for that, would it? Or have I misunderstood that? Thank you.
So in terms of we had funding just to utilise that as a preventative approach, so not the court-ordered perpetrator programmes, and we had, I think it was £40,000. We were only allowed to kind of commission from one of 3 providers, which we did. That contract has now ended. Until we know what funding we're going to get next year, we are spot purchasing places on perpetrator programs where, you know, that's a need, but we think it would be better value to have a kind of contract with a perpetrator program, and we've obviously kind of been looking at the evaluations of that. But again, it's difficult because the funding that we get, so the community safety funding, is done on a year-by-year basis. So it's difficult to kind of plan long term because you never know what you're getting. And I think, as I've touched on in the report, the funding that we get from central government, we used to kind of bid for that and get an allowance of around 101,000, and that's changing to an allocation rather than a bid process. And we don't know as yet what that's going to be for next year. So we're kind of like flagging risks and looking at how we can kind of mitigate them. But perpetrator programs is a gap in our provision in terms of, like, you know, having good value and having something that we're working with kind of constantly. And this kind of spot purchasing system doesn't work as well for us and doesn't provide best value, really. So it's something that's kind of on our radar and has been discussed at Safer Trafford Board as well.
Thank you so much for that. Helen, would you be able to update committee on the progress towards that funding? I think that's something we would probably like to keep an eye on.
Yeah.
Thank you so much. Councillor Hartley, you have a question.
Thank you, Chair. Yeah, it was just quite a specific question, really. In the paper that we've got, where it talks about next steps for domestic abuse services. First of all, I should just thank you all really for coming to speak to us, and thank you for sort of stepping up so quickly and to deal with, you know, a really terrible consequence of COVID. So sorry, back to my question. In the next steps, it's at paragraph 5.4 in the paper that we've got. And this is about work is planned to look at information sharing between primary care and GMP, reviewing that from an information governance and legal perspective. Provisional plans in place to review this and potentially create a contract where GMP will share this information with primary care. It was really just a question, or maybe a plea, that could schools also be involved in that work? So I used to be a governor at a primary school in Old Trafford, and they were forever sort of tearing their hair out, really, that they were the last to know that there was abuse going on in a family, and quite often they'd get a bunch of letters from GMP that would come through in the post, you know, several months after something had first been reported, and conversely, they were reporting concerns into safeguarding really quickly, and so it just strikes me that they have got a crucial role to play, where there's children in the family, if to spot the signs of abuse, either of the children or abuse, you know, between spouses or partners. So it's just really if you've got any plans to try and involve schools in that information sharing as well.
So there's an operation called Operation Encompass. So where there is an incident that the police become aware of, where there are children in the household, they now have a process in place where they will inform the school, so that the school are aware that, you know, child has been in a home where there's been a domestic abuse incident. And we have got currently a specialist member of staff within children's services who works within that. But again, funding, long-term funding for that is a potential issue that we are looking at the moment. And this is what, you know, a lot of these services come down to. We can come up with really, really kind of good ideas and put operations in place. And then it's, you know, making sure that we've got sustainable funding to keep those services running, because I do think Operation Encompass is particularly important. And that's been kind of ongoing in Trafford for a while now, and something that we certainly want to keep going.
Brilliant. Thank you, Helen.
Thank you, Councillor Hartley. Councillor Taylor, you have a question.
Again, can I just thank you all for coming this evening and for the incredible work that you've had to do, you know, and step up at very short notice, really. And I was going to ask a question similar to Councillor Hartley regarding the multi-agency work, really. I just wondered, has this highlighted that there are particular demographics or sectors of society that have been at greater risk during this time, or parts of the borough in Trafford, or has it been right across all sectors of the community, really, that have been affected by this?
Sam, I don't know whether you're better to take that from a service point of view. I think kind of, you know, what we know from research is that domestic abuse occurs, you know, in all situations. Sam, I don't know whether you've seen any particular trends during COVID around that.
Nothing that strikes me any different to pre-COVID. It's been pretty much kind of the same, you know, across the board, across all kind of demographics. So there's nothing that shouts out that there's been kind of any major difference compared to what it was like before COVID kind of hit.
Pretty much, as you've said, it affects all sectors of the community. Yeah, no, no one sector more so than another. No,
not that. No, maybe, you know, it might be that you know, we do kind of get a lot more referrals from the north of the borough, but that's always been the case, really. It's no different. And that's why a lot of before COVID, the idea was we would be a lot more place-based across the borough, and we'd have staff members sitting within multi-agency teams and a lot more outreach work to kind of meet and try and kind of encourage hard to reach communities. But then COVID came along and stopped them plans. But yeah, there's nothing that kind of shouts out that's any different really in terms of that.
No. I thought the work that you described that you've done around supermarkets sounded a really, really good idea. Would that be something that maybe with the funding, you know, because that's they're like global, aren't the supermarkets, you know, and anybody goes in. Is that something you might continue to have a look at? Was that a success, do you think?
It was probably more effective in the main kind of lockdown, and perhaps more so now when people were shopping alone. I think when lockdown got eased and things kind of were a bit more normal, less so. So I think for us it was around kind of getting that message out at the beginning where people thought services had stopped. I think people are more familiar now with services being delivered in a slightly different way. But I know that because we struggled, I won't name names, but we did struggle with one of the supermarkets, and our district commander superintendent Hemingway was listening to a radio programme and heard an MP talking on it, and so contacted that MP and said, can you help us? I know it got raised in the House of Commons, but that person did intervene for us and got some help. But you know, it's pleasing to see that kind of model in terms of having safe spaces and reporting seems to have been taken up now on a national basis, and there's pharmacies on board with it now. So I think, you know, people are much more on board with it. I think there's lots more places that people can go, and I think that generally the public are aware that those services are operating, albeit sometimes in a different way depending on the current lockdown situation. But
okay, thank you. With some brilliant innovation again that's come out of this pandemic crisis, hasn't it?
Thank you, Councillor Taylor. We have quite a few questions left to ask our speakers. There's so much to ask of you. Questioners, could you please keep your questions quite brief, because obviously we really want to get through them all. So could I just ask Councillor Weston for your question, please?
Thank you, Chair. It's just a very quick question. I'm just wondering if we as a council, and I'm speaking of us as Trafford as an employer, do we have a domestic violence policy in place at all to protect? Yeah.
Yes, we do, and we very much kind of promoted that as well, because we were kind of aware that we were asking members of staff to work from home predominantly, and so we were very mindful of, you know, we will have staff members who live in those situations, and you know, we very much wanted to kind of encourage people to come and talk to us and flag that if that was an issue for them.
Excellent, thank you very much.
Thank you, Councillor Weston, for keeping your question brief. Councillor Cordingley.
Thanks, Chair. Dead quick, but it might be impossible to answer. When COVID restrictions end, which they will do one day, is there a danger that we're expecting everything to turn back to normal? And actually, that could be our most tricky time for domestic abuse. And I'm just wondering if there's a risk at that point of actually cuts coming in and services being pulled a little bit, just at the point where we probably need the most. It's almost as the front doors open and people go out drinking and what have you. And I'm just floating that proposition, really. Probably better for Sam, I guess.
Yeah, that's been kind of one of our biggest arguments moving forward, because we've been extremely grateful for the COVID emergency response funding that we've had to be able to adapt and increase capacity, but there needs to be long-term effective funding for services, and that is being echoed across the country. I know Women's Aid are behind that, and they're kind of petitioning governments to ensure that it's not just seen as a short-term thing. You're absolutely right in what you're saying, and there'll be so many reasons people will be staying in relationships during this situation, and even though they now know, thankfully, in kind of the Prime Minister's latest announcement, he mentioned domestic abuse and the ability to be able to leave. So people are more aware that they are able to, but they will stay in that situation for a variety of reasons. So we absolutely need long-term we need to look to after COVID and the effects of that, and are we going to have the capacity, the ability to not just, there's the fear of not just in the increase, but delivering at current capacity too, like you say, with the cuts that are potentially coming in and things. So there definitely needs to be kind of a call for action, which I know that there is a lot of that, nationally happening.
That's great, thank you.
Thank you, Councillor Cordingley. Councillor Axon.
Oh, thank you, Chair. Can I just thank you for the brilliant work that you are all doing, particularly in these very difficult times. And I'm very impressed with the initiatives that you've been taking through this pandemic. We of course are all councillors, and we sit on the Scrutiny Committee. And I was just wondering, really, is there anything that you think that we could do to help, whether it's communications, whether it's helping in terms of supporting the work that you do? Clearly, there's not a great deal of money around, but I do think that there are, we have buildings and we have things that we might be able to support you with, and it would be useful for you to be able to tell us if you do feel that there's something that we can do to help, because I'm sure that all the members across Trafford would be willing to give that help and support, but it's knowing how to do that, really, I think.
I mean, there probably is, and you know, we've had help from individual members and a variety of things, from you know, putting us in touch with people who've been able to provide temporary accommodation to kind of getting donations. I think, you know, keeping the kind of issue of domestic abuse on the agenda really, and just, you know, recognising how important an issue that is for us as a local authority, but for our partners and our residents, because it does cross-cut so many different services, and sometimes that kind of investment and work at the beginning can help save money down the line. So, for example, we're funding lots of activity around kind of knife crime reduction that's looking at kind of young people and youth violence. And what we're invariably finding is that lots of those young people who are involved in knife crime come from households where they've grown up with domestic abuse. So it's you know, keeping that at the forefront of everybody's mind when we're thinking about kind of conversations that we're having, or we're talking about budgets. And I know money is really, really tight and cuts have got to be made, but it is just so important, and the economic costs of it, you know, on society and kind of generally are huge. So it's, you know, it's that sometimes you have to spend at the beginning to save money, more money down the line. But thank you.
Yeah. Okay, thanks.
Are there any final questions? Just, it has to be really quick, unfortunately, just because we're running out of time. Any final questions for our speakers? Can't see anybody. And Councillor Slater has put a comment. Thank you, Councillor Slater, for your comment within the chat about the equality work that will incorporate domestic abuse. So that's fantastic. Thank you for that. So there's no final questions. So I'd just like to thank Sam, Helen and Joe for coming this evening, for all the amazing innovative work that you are doing for our residents. It's hugely appreciated. I just wondered if you would be happy maybe next municipal year, obviously not to put you under any pressure at all now for some time, but just to hear, maybe have a little bit of feedback about how the service is progressing next year in terms of capacity and funding and the perpetrator programs. Would that be something you'd be able to do? I mean, just a short feedback, that'd be fantastic. Also, we don't want to lose touch with this topic. It's really, really important. I mean, the more I read about it, the more I realised how crucial it is. So just say thank you again on behalf of all the committee for attending this evening, for your time, and thank you again. Thank you so much.
Thank you for having us.
Thank you. Thank you. Good night. Okay, so while we're saying goodbye to our speakers, move on to agenda item 7, which is lessons learned report from the community response hubs. And just before our speakers introduce themselves, just want to say that I really absolutely understand the importance of working locally, just how it kind of makes connections that are just not possible, or as possible, or as likely, or as effective when they're not done at a very, very local level. And I think the hubs have really succeeded because of that. And so today we wanted to hear from you. Obviously, we thank you for the report, the massive report that you sent us. It was a brilliant long read, really enjoyed it. I'm sure other members did. But if you could perhaps just highlight, because obviously time is limited, what you feel the lessons have been learnt for yourselves as hubs, as managers of hubs, what you think you can do in terms of rolling out that model to improve other areas of health and non-health related, maybe even things going forward. Thank you.
Okay, thanks, Chair. I'm going to introduce the report, and Joe Gibson is with me on the call as well to kind of chip in with any areas that I miss. So I'll give an overview, but I'm not going to, as you say, do a very comprehensive talk through of the report, because you've had the report in advance. So if I just give an overview and then open it up to the committee to ask any questions. So the question you asked us was sort of lessons learned from the community hubs. And as you know, like other members of the committee had said, I too was stunned when I saw those minutes and realised that it was March that I last attended your committee. And I can't believe that it's been almost a year that we've been working through this pandemic, really. And I'm sure many of us have learned lots of lessons. And I think the one thing I would stress is that we are continuing to learn, that it's an evolving picture, really, and we haven't got the solution yet. We're continuing to learn and develop our sort of models and future strategies for Trafford, really, as we come through this pandemic. So some of the key things that we've learned, I guess, is that just how flexible, adaptable and responsive we can be when we need to be. So in all the years, and I've said this before, in all the years I've been a counsellor, I realise that there are sometimes barriers and challenges that we put out there that sometimes we make them more difficult to break down, whereas actually in the space of 10 days, 2 weeks, we had knocked down an awful lot of those barriers and challenges and had those 6 community hubs in place. I think we've learned that the spirit of collaboration and partnership is the best way to work. I think we've learned that it isn't about the council and statutory organisations doing things for people and to people. It's about the spirit of co-production and collaboration, where we start to work together to formulate the solutions that communities need. I think we've learned that we've had an awful lot of data across the council for many years. So, for example, we have the JSNA, which I know members of the committee will be familiar with, which we use to look at how we model and commission for future healthcare. We have the Health and Wellbeing Board that has strategic oversight. And we have, of course, this committee, which holds the executive members to account. So we've got a rich wealth of data, really, and what we need to do is make sure that we make better use of that data so that we target our interventions and commission accordingly. We've also learned that one of the things I've learned is that as we have the hub meetings once a week, so every Tuesday, the 6 hub leaders come together. And that has been an absolute brilliant network of partnership working, really. What we do is bring in external speakers as and when are needed. So we've had mental health, we've had Trafford Assist, we've had food banks. We have lots of different speakers coming in as and when we have a specialist subject that we need to know more about. But one thing I've realised as a result of these meetings is the erasure of the North and South divide, if you like, and the recognising that all of those different localities work very differently. So we know that Partington is very different than Altrincham. We know that Sale is very different than Stretford. But what we have seen of all of those hub leaders coming together is the spirit of sharing that good practice. When they all get together, that model of peer support has been fantastic amongst all of them. They're all ready to help each other out. Some of the hubs are developing models because one of the things that has been absolutely prevalent throughout this pandemic is mental health and loneliness. And we're seeing more of that because people have been isolated for such a long time that some of the hubs have started to create things like buddy groups and walking groups, obviously socially distant and safe, but there's areas of innovation that the hubs are starting to trial. And if one hub has started it, another one has said, oh, can I learn from that? What have you done and how can we develop it? So they're sharing good practice and people are working together. So I'm just looking at my list as I've gone through the report here. So like I say, partnership. So where we are now is we thought we were going to be moving out of this in September. And of course, we've gone into another lockdown. So we're back again supporting clinically extremely vulnerable residents. And what we now have is the strategic design groups, really, to look at what the future will be like in Trafford. So that's partners coming together to develop some of that strategy. And our core areas of work, we're developing place-based working. And from a personal point of view, I really don't like place-based because I don't know what it means sometimes. But I think what I think it means is that we're developing it's communities working together to develop their own solutions. I think that is a better way of explaining than place-based. There's a Trafford-wide approach to look at what we need via advice and information, because the Citizens Advice Bureau that staff the triage number before they refer to the hubs, we're now starting to see more calls coming through around things like financial issues, unemployment, debt, and so on. So we need to better understand what we provide across Trafford that can support residents around debt management, unemployment skills, etc. Another group is looking at the reduction of health inequalities. And again, all of you on this committee will know that Trafford is a very diverse borough and it masks health inequalities extremely well, because we look outwardly, we look to be a very rich borough, but we know that we've got pockets of real health inequalities in some of our boroughs. So We have to stop talking about reducing health inequalities. We have to reduce those health inequalities. However, how we do that against the backdrop of, you had the CCG colleagues on earlier on talking about, we're going to have huge waits around cancer wait times, surgeries that haven't been done, mental health and so on. So we know that already we've got a huge issue there. So we're starting from a place where we're playing catch up when we already knew we had a lot to catch up from. So we've got lots of work to do. And the other group is the strong voluntary and community sector. And some work has been done on that to make sure that the collective is now constituted, and that will be looking to bring together all the voluntary community and faith sector. So we've learned there's lots of goodwill, there's lots of kindness in our communities. Lots of people want to volunteer. That's another lesson learned, really, that how do we develop the volunteer offer? We had so many people volunteer that then sometimes there wasn't roles for them to do, and we ended up with volunteers kind of dropping off or going back to work. So we need to develop our strong volunteer academy type offer. What does that look like for Trafford? So that in future we can start to deploy volunteers into different roles as and when we need people. But equally, those volunteers are developing skills so that it makes them want to look about future employment. It's the way we support each other, really. So I think I'll stop there, really. And Joe, if there's anything that you want to add to that, or there's any questions, I'll leave it to you.
Thank you. Hi, Joe.
Hello, so I'm Jo Gibson. I'm head of commissioning and happened to be at a certain place at a certain time back in March. I found myself suddenly thrust into sort of the community response to COVID, but it's been an absolutely fantastic experience. I think Joe's very eloquently put all of the lessons learnt there, really, and we've worked really close together over the last 12 months. I suppose one of the things which is really important to understand is, I think that crisis and that going into the pandemic brought an awful lot of clarity very early on, and I think that enabled us to move very quickly. So it was very obvious that we needed to support the community around a humanitarian aid response, around food, around medication, around that sort of social isolation, and I think the hubs were able to step up those services very, very quickly and very well. As we move though into recovery, I think it's a bit more building on the domestic abuse kind of conversation that we've just had around sort of complexity. So actually moving into a recovery situation where we are trying to build perhaps that hub model in the locality, in the neighbourhoods. Actually, it's much more difficult to be really clear about what we want those hubs to do. So it's a bit of a different ball game, really. I would also just say, I guess at the moment the community hubs are run through a memorandum of understanding. There is funding streams available, but it's really through sort of various grants that they can apply for, and there's a national lottery bid which our infrastructure contract Thrive and CAB sort of led on, and making sure that hubs were funded through that. And we're also being able to fund the hubs through the clinically extremely vulnerable funding that we've got as well. But I think one of the key things for our Living Well in My Community group is to really understand how the model that we want in the future and how we sort of move towards that. And that's where that group that Joe's described around the voluntary sector is really key, in making sure that we've got that really strong funding there, but not just led by Trafford Council. It absolutely has to be led by very much a partnership approach to ensure that we all own those outcomes that we want to achieve together. So I'll leave it there, but yeah, it's been an amazing piece of work to be involved in.
Well, thank you, Joe, Jan, and Joe, and Jan.
It's a lot of Joannes tonight, aren't there?
Joe and Joe. Thank you so much for the amazing work you do, and the energy and time. And I mean, it's really apparent to all of us how much you put into the hubs and all the hub managers. And I mean, I've actually used, asked residents to get help from the hub, and it has been absolutely amazing and almost reduced me to tears when I accessed help virtually within an hour of me contacting you. It was just, you know, it was really emotional, and it's been an amazing help. So could I just ask, we have a couple of questions. If anyone else would like to ask a question, please do put it into the chat. But just before I take questions from members, could I just ask, do you have any plans to roll this out to encompass more other roles within the hub structure? To take on more responsibilities, more functions, more, I mean, for example, I think Joe mentioned the buddy groups and the kind of tree walking groups. Obviously that's great for socialization and mental health and, you know, physical health as well. Are you looking at kind of developing anything else like that? Thank you.
I think, as Joe mentioned, really, as we're working through COVID and we go to recovery, it's an opportunity for us to develop what we really need across Trafford. And remember that some of these organisations that are the hubs will go back to some of their business as usual. So, for example, Age UK in Urmston was already running things like dementia daycare and specialist dementia services. So they will have to, at some point, thankfully for a lot of people in Trafford, they'll go back to their business as usual. However, one of the things that we've looked at with this is this the model that we need in Trafford going forward? And we think something like this structure, obviously, that working in those geographical areas, definitely the partnership working, definitely the collaboration, and working with, you know, smaller community groups that will do very bespoke things for people in the community. And that might be that we just, you know, look at a way that smaller grants can go to bring some of that work on board. We're having discussions about what commissioning looks like, and, you know, so we are in a place where we're really thinking. But in response to your question, I think that's what I said before about the data. What does the data tell us what our needs are? Where are the gaps and how can we bridge those gaps? So what do we need to do? And I think what is apparent, though, that there is definitely going to be a big need for things like how we address the loneliness and social isolation. And a huge thing that has come out of this is how digital connection, or lack of, for some people has been apparent. You know, we're all really lucky. We can do our day's work. We can connect. We're on screens, etc. We've got our phones. There's a lot of people in our communities that simply don't have access to that. We've realised that from homeschooling, which children don't have access to laptops or tablets. And even if you give them a laptop and a tablet, have they got the Wi-Fi at home to be able to access? The same goes for older people. So I think we do need to look at what that looks like. So it's about, as well, not just the voluntary and community sector. What can private organisations, what can businesses in our community contribute? What's their corporate social responsibility? What does our social value, what do our contracts look like? What about when we have planning? What will developers bring into the area? I think we need to have much wider conversations about what our communities look like. But yes, of course, we want to develop the offer to make sure that we meet everybody's needs in our community. But it won't just necessarily come from the council. It will come from a variety of organisations across that neighbourhood, really.
Can I add in, it'll come from the communities themselves, won't it, as well? You know, actually, each of the hub has got a very different offer. Well, say that there are sort of core things which are common, but the hubs have developed in response to the needs within their community, and that I think is the beauty of the approach that we've taken, and you know, that co-production sort of approach. So yes, they will inevitably develop services and you know, different support services that will help people within their community.
So, for example, at the beginning, we found that food is still a big issue. But you know, the supermarkets have now developed different offers for clinically extremely vulnerable. So things have moved on. Prescriptions, dog walking was one of our offers, but we found that we simply didn't have the demand for dog walking. So we've had to tailor the offer as to what the community tell us they need, but people have been responsive to meet those needs.
Oh, thank you both for a very full answer to my question. We have a number of questions from members, and the first question is from Councillor Chilton, please.
Yes, thank you, Madam Chairman. Obviously, what I helped out in the Sale Hub during the first lockdown, we've now thankfully been able to hire staff to do it. One thing anecdotally that we found at the time, I mean, obviously there have been much rehearsed problems with communicating the fact that the hubs are available and help was available to people. But when that, even when it was communicated to people that help was available, we found a real difficulty in getting people to accept help. That particularly, it has to be said, the elderly, help to which they're entitled, they wouldn't take it quite often. And even, you know, when eventually they did, they were sort of falling over themselves with apologies for troubling us, which was slightly ridiculous. As far as I was concerned, they were quite entitled to the help. I think that's a cultural thing that somehow we need to think about how we get over, because these people are entitled to help and they just won't take it. So, thank you.
Yeah, I think it's, you know, one of the things we did when a survey was originally carried out, you know, some of the findings were that people simply didn't know about us. We made sure that a letter went through every door in Trafford. So we did make sure that a hard copy went to every household in Trafford, and it didn't just have the hub numbers on, it had a variety of different help numbers for domestic abuse, for mental health and well-being, for all kinds of emergency numbers. So, you know, it's as and when people need it, because I think the other role of the hub is to empower people to find their own solutions too. What we don't want to do is create dependencies so that people are reliant on the hub every week, for example, to provide a food parcel or to you know, assist with fuel poverty. What we need to do is develop a package of care for that household. What are the other organisations in that community that can help them, support them around the things that they present with? So it is about empowering communities and empowering those residents. But yes, I mean, anything that members of this committee and ward councillors can do to promote those messages, then, you know, please do. And that's why opportunities like this for us to give updates are really valuable.
Thank you, Councillor. Councillor Weston, sorry, Councillor Haddad, please. I think you have a question. Sorry.
Thank you for your presentation. And again, you know, I just want to echo the thanks. Obviously, we appreciate the work you do because it's fundamental, isn't it, to building good communities where people feel supported. And I'm just trying to phrase my question. You know, you've given us a lot of really good information about the learning that you've you know, had whilst the pandemic's going on, and the collaboration with professionals, and, you know, wanting to develop a model for the future, and collecting a lot of data. And I suppose my questions, and you know, as Rob said, you know, making sure that culturally we're able to reach the people that need to be reached, and that they'll accept help and be engaged. So my question's really around all of that is how, moving forward, how will you collect the data? How will you structure the learning, if you like, and get it into a model? How will you do that practically? I mean, have you got the expertise, without sounding rude? Because, you know, it's one thing doing the day-to-day and collecting the data, but sort of analysis, you know, that type of work needs to sometimes be done by statisticians and academics who maybe have got that kind of expertise to bring. So I just wondered how you would move it forward.
Thanks, Councillor Haddad. I'll bring Jo in as well to some of this, but I just want to say about expertise. The Programme Management Office that we have in this council, and I particularly want to give a recognition to Catherine O'Connor, has been incredible. And she has the skills, she has the expertise, she's got the passion, she's got the enthusiasm, and she's absolutely fantastic. She's been a brilliant addition to the work that we all do. You know, and as well as Jo and, you know, the team, that we've become a really tight, cohesive team, I think. We meet every Wednesday in some form or another. But it's a really valid question, because sometimes you have to be careful that you're not just talking to an echo chamber and you don't all think you're saying the right thing and actually not doing the right thing. So we've had we've had a discussion today about data as well, because one of the things we want to do is make sure that, so I hear a verbal update every week from the community hubs about what's happening and food parcels, etc. But one of the things we need to do is make sure that we collect the data. And we did used to collect the data at the beginning in a very simple Excel. And we're now looking at what the next steps for data collection might be, how we gather that, how we formulate that, and then how we develop the needs as a result of that. So it's quite a timely question, because that's actually the work that we're doing now as we're modelling for the future, if you like. But we have got, and I think Tom Maloney is part of the team, and George Devlin. There's lots of skills within Trafford, but also there's lots of skills in the community. So what we're keen to do is the work I'm leading on is some of the mental health and loneliness. So, for example, we commission services such as Blue Sky. We've got children and young people services. So we need to bring in the operational providers to help us look at the actions. So it's a good question, and it's definitely something that we're working on now. Joe, I don't know whether there's anything you want to add.
Yeah, can I just add, what we do very easily collect is all of the CAB data, so all of the call data that goes to CAB, and that goes through onto the members' dashboard actually. So you can see all of that, and you can see all of the shielded data as well, and the contacts that we have with the shielded population. So we have got data flowing, but Joe is absolutely right. I think in terms of getting data back from the hubs, that becomes a little bit more tricky, because we've got a memorandum of understanding, but we're not really, wanting to hold people to account in terms of that data at the moment. So we do need to do some work on that. Yeah, so we've got a good start with the data. We also, as part of the Living Well in My Community group, we are developing that measurement, and all of the strategic design groups are sort of making sure they have got that measurement framework behind them as well. So we will be developing that as we go through and as we move forward in those different areas of work. I could just bring your attention as well to some of the work going on within the information advice subgroup, because one of the things that CAB are leading on there is to make sure that there's it's a refer net system, so that we can start seeing traffic across the system a little bit more, which we're not getting at the moment. So that will help us then for sort of hubs and other organisations. So the likes of Blue Sky, the likes of our welfare rights service, for example. So we'll be able to see then some of the kind of traffic and how it's moving across the system, and get more intelligence from that as well. So it's something that we're working on.
Thank you. And, I'm sure you have a wealth of expertise. It's just really hard, isn't it, sometimes to pull it together. But if at some point you can, keep us updated about it, I'm sure it'd be very exciting and interesting. Thanks again for all your work.
Okay. Thank you, Councillor Haddad. Yes, I just would like to echo if we could be kept updated with a brief report. If you produce any reports, you share them with committee, that would be much appreciated. So unfortunately, we do have kind of slightly overrun, but we do have 2 questions which I really want to be able to get to. So members, if you could keep your questions brief so that we make sure we hear some full answers, I'd really appreciate that. Thank you. So over to Councillor Taylor, please, for the question.
Sorry, I didn't realise I was up next. I actually think all my questions have been answered, and thank you so much for your report, which was really extensive and a really good read. I just want to say thank you so much to yourself, Joanne, to Joe Gibson, and all of your team and the collaborators, and acknowledge our volunteers across the community as well. Each hub has been quite unique, really, in the way that they've offered it, but they've been, I think what has been really sort of notable about them is that they've been shaped towards the needs of the community. And as you said right at the start, Joe, people are not being done to. They are people are being offered something that they can accept and work with and involve themselves and immerse themselves. And I just think you as a team should feel immensely proud of what you've done. I think we in the community in Trafford are immensely grateful to you. And I think there's just been some incredible hard work, goodwill, innovation, good practice, just the community has been at the heart of everything you've done. And I was just astonished. I mean, at the start of the pandemic, I'm an NHS worker and I was absolutely caught up in it, and working as a frontline NHS worker, and I couldn't be involved in the hubs. But all of a sudden, within literally days, these hubs emerged, and it was just breathtaking, really. So I just want to say a huge thank you to you and to everybody who's been involved in the hubs, so absolutely great work. And I know, this will lay the foundation for innovation and good practice going forward. I think a lot of different ways of working will come out of this. So I think it's been immense what you've done. Do not underestimate it. Thank you very much.
Thank you.
Thank you, Councillor Taylor. I totally agree with all of your comments. Councillor Hartley, please.
Thank you, Chair. Yeah, I'd agree with that as well. I mean, I've been blown away by what a great job the hubs have done, how quickly the whole operation was set up. The demand was obviously there for that sort of service, that local service anyway, and the pandemic, brought that into sharper relief. So, yeah, huge sort of applause for everyone involved in getting the operation up and running. My sort of question was sort of twofold, really, and it's to do with, I completely agree with what Joe said about the response is really rooted in communities, and one thing that has really struck me through the pandemic has been that sort of need for help. This follows on a bit from Councillor Chilton's question as well, actually, about people not being willing to ask for help, and in a way that obviously the hubs can only do so much, and it feels like we're in a time where the council isn't local enough for people, and the hubs aren't local enough for people, probably because you'll never have enough of them. So there's a lot of people who have found themselves out of work, have seen their earnings go down, and they have never claimed benefits before. That so it's a sudden drop of income, and so I don't know if it's a comms issue, but it's those sorts of people will be quite happy to go and get help from a neighbour, or they'll go and get help from a local business. When people were needing food to replace free school meals, they'll quite happily go to a local business. And then on the other side, there's a lot of goodwill, again, I think at a hyper local level. So, the sort of cynical way of describing it would be, people are never happy when their council tax goes up, but, they will give £10,000 in cash donations to a local business because they're offering free school meals. So is there a way we can sort of capture that hyper local goodwill, and is there a way to bring people in who need the help, who perhaps aren't asking for it? Or is that, I don't know, are we overreaching ourselves, and is it you just let that activity go on, and people will come to you if they really need it? Or is there more to do, sort of to reach out and get those people into getting the help they need? Does that make sense? Sorry, it's quite a long-winded question, but I just, yeah.
That's a great question, actually, Ben. A really good question. And also the point of the question you asked, is there more to do? And it just made me think then of an area that I'd missed. So the other bit that we've been trying to do is develop the mutual aid network. So, for example, the Stretford Community Hub were absolutely brilliant in they mapped out a street level network. And that was, basically neighbours looking out for each other. So if they got a call from somebody, they could connect to one of their mutual aid leads and say, you've got Mrs. Jones on your street that might need a newspaper or some milk. And that was at that hyper-local level. Now, we've had 2 mutual aid conferences because the plan is we wanted to roll out more of that across Trafford, or basically give people permission to do that across Trafford. But what we found when we had those conferences, it was mainly organisations, voluntary sector organisations that were already constituted that were coming. So we weren't really hitting the target audience to do that. But what we want to do now is try and harness all what was happening at the beginning of the pandemic when letters were going through people's doors with numbers on. It's a bit like we're now looking at a campaign that's about a community charter or a friendly streets type scheme. And we're developing this, Your Street Needs You. We're just looking at how we do that, and it will be where we get people involved in that. There might be a sticker that goes in windows, and it's a little bit like then a network is formed at a hyper-local level. And that may be then that community can look to apply for certain funds if they want to do something in their street or their neighbourhood. The other thing we did was we developed the Trafford Crisis Fund. So that's there to support people we've had people who've needed white goods, or when it's been over winter, they've had a crisis. So we've developed that fund as well. But you're right, it's about, so how do we capture some of that really goodwill that is there in our communities? And it may well be that we need to do it via your Friendly Street network. So these are all ideas that we're bouncing about, that we're really keen to develop, that mutual aid network and communities doing things for themselves. So there's more to be done. And we think if we can do that, and there will be some comms around that, then that's another way that communities help themselves. It's that early intervention offer then, because we're rolling out some mental health and suicide prevention training at that street level. So that's the early intervention where people start having conversations with each other, and maybe it takes them pressure off other services, but it's communities doing things and working with each other rather than having things done to them. So that was a very long-winded answer, Ben, to a great question, but I hope it answered the question.
It did. Thank you, Jo.
Jo Gibson, did you want to add anything to Joanne's reply just before we finish?
I think one of the slides I can't remember whether it was in this pack, but one of the slides we had developed quite early on was this kind of idea where actually, friends and family help friends and family, and then it's the mutual aid, and then it's like maybe the hubs, and then you get up to statutory services, don't you? So it's this idea, it's a continuum that we really need to develop across that whole continuum to make sure that communities are as strong as possible. And the other thing I would say is I guess comms is going to be so important about making sure that we do channel people to the right place, going forward. So
Oh, well, thank you, Councillor Hartley, for your very important question, and thank you to the two Joes for a really fantastic contribution this evening. Really, kind of the work you're doing is transformation. It's kind of almost makes me feel emotional thinking of all the things you're doing, and it's amazing. So thank you so much for coming and for giving us all the information. We have actually reached the end of the agenda items for consideration. So if you would like to leave and finish this for the evening, thank you so much. Really
thank you.
Coming.
Thank you very much.
Thank you. Goodbye. Thank you.
Thank you.
Oh. Okay, so members, thank you so much for the brilliant questions you've asked this evening. Been absolutely inspiring. I've learned so much myself from listening. Just to complete the agenda and make sure we don't go on for too much longer, I don't have any urgent business. Can I just check with Fabiola that that's correct?
Correct, Chair. Yes, no urgent business. Yes.
Fantastic, thank you. Okay, we don't need to move an exclusion resolution, so really all that's left to do is, unless members have anything they would like to raise.
I just want to thank Fabiola for pulling the meeting together.
Of course.
Which I knew you would say anyway, Councillor Barclay, but
of course I was going to, absolutely.
So hard and it's so efficient, so thank you. Yeah.
Exactly. Yeah, I mean, can I just say that, just to follow up from Sophie, the meeting couldn't run without Fabiola. So obviously Sophie spoke before me, but absolutely a huge thank you to Fabiola for all the support you give us throughout the weeks building up to the meeting and beyond. Yes, someone wanted to ask a question?
Yeah, it was me, Councillor Cording. Dead quick. One of the first things I got when I joined this committee was a sort of vague invite to the Public Awareness COVID Committee. And it suggested that this committee, the Scrutiny Committee, sent one member. But since our first meeting was tonight, I didn't know whether I could go to that COVID Committee and whether we have appointed anybody or whether we're just doing it sort of, if anybody's available, they can turn up to.
Chair, which is the reason I'm attending, because I chair the public engagement board that Councillor Cordingley is talking about, and I would welcome any members of Health Scrutiny who wish to attend that meeting. It's a public meeting, and you're very welcome to attend the meeting. It meets fortnightly on a Wednesday morning between I think it's 10 and 11 o'clock, and you're very welcome to attend. And I will continue whilst this board is running to attend your meetings, because it's very important that I know exactly what the issues are coming from Health Scrutiny whilst I chair that public engagement board on COVID-19.
Does that answer your question, Councillor Corning?
It certainly does. So we're all invited. That's great.
Yes, as far as I'm concerned, yes, you're very, 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 anyone's welcome to attend that meeting, yeah.
Oh, that's fantastic. Thank you so much, Councillor Freeman.
Sorry, can you just ask if we want to attend that meeting, Mike? And I did see those communications and was thinking about it. Do we just, how do we get the link?
Actually, speak to Fabiola because she arranges the meeting for me and she can send you the link. Is that right, Fabiola?
That's correct, Councillor Freeman, yes.
Okay, okay.
Yeah, because I need the link again, yeah.
Okay, I'll just quickly check. There are no final questions for anyone. It is 8:45. We have run over by a quarter of an hour. I thank Fabiola for her patience in accepting the late finish. Thank you so much. If there aren't any other questions, then I just wish you a good night and thank you so much for your attendance and questions, and keep safe till we meet again.
Thank you.
Thank you, Jay.